Hi, it's Dr. Toker. I'm here to discuss our HcG diet and modifications that we've made in the last year based on our own experiences and patient outcomes. The first question I want to answer real quick, because I will take down some of my old videos, is what is HcG? How does it work? And what could possibly go wrong? And then I'll go over timing real quick of what our diet is going to be. First of all, what is HcG? HcG is a hormone that is created by pregnant women. Its job in the body is to stimulate a part of the brain called the hypothalamus to make several hormones. One of those is luteinizing hormone, and the other one is follicle stimulating hormone. Both of those hormones are designed to increase gonadal function and therefore increase your body's estrogen, progesterone, and testosterone. Clinically, we give this medicine to women to improve their fertility, to children who have not reached puberty, and they're in their late teen years, and then for adults who have gonadal dysfunction at an early age, such as low testosterone is probably the most common indication. And so we use this for gonadal function normally, is what it's FDA approved for. However, HcG has a very unusual property in that it also stimulates part of the hypothalamus that is designed to allow for homeostasis, and in particular in where your body stores fat. And so there's an interesting paper I would like everyone to read on our website. If you go to Clean Start and then scroll down to the bottom of the page to where it says Dr. Simeon's paper, this diet and this process was first explained by an Italian endocrinologist. And basically what he explains is, if you can imagine fat stores as being sort of like money, and you put money in the bank and then you can take money out, and so that's the calorie in, calorie out phenomenon that most of us associate with our weight and how to lose weight and how to gain weight. Well, Dr. Simeon's identified what we all know, is that doesn't always work. There are some people that even when they're not eating very much, they don't seem to lose fat weight. They'll lose structural weight, so like they'll get thin or unhealthy in the face or in the arms or the legs, but that like spare tire thing going on never goes away. And so he described that type of fat as being autonomous, no longer under endocrine control. That is very similar to having a rich person with lots of money just sitting in the bank, and the banker saying, listen, your money is better off if you invest in this piece of property. It's no longer going to be a liquid asset, but it has value, and we'll just plop it over there. And no, you're not going to be able to withdraw money from that unless you sold the whole thing, but you would still own it. And so your body goes through this type of banking investment phenomenon with body fat. And once it's locked away as a real estate investment, you can't get to it. You can't take money out of it. You can't remove fat from it. It's completely on its own, unresponsive to the normal ways that one would try to lose weight. This process seems to occur as we get older, and also seems to have a genetic component. So sometimes we see it in even younger people. But we believe that process starts in the hypothalamus. And the unique thing about HcG is that it can unlock that. It essentially puts that piece of property up for sale. And if you take this hormone in conjunction with an extremely restrictive diet, you can access that little spare tire that's been inaccessible to you for many, many years. So that's the purpose in a diet of taking HcG and coupling it with the low calorie. So taking HcG does not make you lose weight. But if you take HcG and severely restrict your diet, your hypothalamus tells your body to sell that piece of property in the midriff area so that there can be some energy assets that are usable. And so patients who are on an HCG diet that's very restrictive and they don't cheat and they follow it specifically will find that they dissolve that piece of property first, as opposed to some of the other things that normal people on a diet will do. So your body will completely remodel as a result of taking this HcG and this restrictive diet, which is why we do it. The original paper described a time interval based on sort of normal endocrine glandular biorhythms, which tend to be about a month in length. Like a menstrual cycle is typically 28 days in length. And so Dr. Simeons noticed that the shortest length of time you can be on this diet is 23 days. Any shorter than that, yeah, you'd probably lose weight, but you would probably put it right back on if you quit the hormone too quickly. So you have to be on this hormone for at least 23 days, and then it takes 3 days for the hormone to get out of your system. So it's 26 days, but you should also never take it for longer than 40 days, which means 40 injections plus another 3 days to get it out of your system. That's a 43-day diet, because the caloric intake is so restricting. We don't want to institute malnutrition in a patient. We want you to lose the spare tire, not critical functional parts of your body. Okay, so the diet has been limited to 40 days, but you have to do it at least 23 injections in 26 days. Okay, so in our own experience, now having done this for 18 months, hundreds of thousands of patients around the world since the 50s have been on this HcG. So it is not unique to my practice. However, in my own hands, I like to make observations of my own patients. And so what I find is that patients will lose 1 pound a day in the first 7 to 10 days on the injections. They will then hit a 2 or 3 day plateau, which is kind of expected. Then they'll start losing weight again, but not at a pound a day interval. It'll be slower. It'll be like a half a pound, maybe a third of a pound a day. They'll do that for another 7 to 10 days typically, and then they'll hit another plateau, and that plateau can last another 2 to 3 days. And as the process of weight loss goes on, the amount of weight you're losing per day gets less and less, and the plateaus get more frequent and longer, which means the first 26 days of this diet are very straightforward, easily tolerated, quite rewarding. You can lose 15 pounds in this period of time with what seems like almost no effort. And then the second half of the diet, the next 3 weeks of getting injections, the more frequent plateaus and the longer plateaus, it becomes harder. It becomes a lot more like a diet. No, you're not miserable as far as the hunger, but you can kind of get like, this is getting to me. Getting kind of tired doing this. And so my thoughts were that why not just make life easy on everyone? Do we really need to have to suffer? I am part German. It's in my genetics to make people suffer. But I'm thinking, let's just be logical about this. Instead of charging people for a 40-day diet, could we not charge people for a 23-day diet? And then if they wanted to repeat that 23-day diet, they could, which means in the end, the number of injections you get of HcG winds up costing the same. But I believe it would be easier tolerated than the 40-day in a row slog, if that makes any sense. So I think I've made an executive decision. This was part of our COVID relief package. We're trying to figure out, okay, how are we going to help people lose weight and without them spending all their money? You need to have cash on hand because the world's crazy. Got to have some cash on hand. So I don't want you spending all your money. But this hormone's expensive. So my thoughts are, we are going to start promoting a 23-day diet for half as much money as we would normally charge someone for the full 40 days. And it's simply because you're only getting half a diet. But you will find that you will lose the majority of your weight that you would normally anyway in that 23-day period of time. So in other words, you're getting a lot more bang for your buck if you do a 23-day diet. Now, if you lost 15 and you really wanted to lose 30, well, do a second 23 days and let's see what we can do on that second end. You would be the person who would do maybe more than one round. But most people, one 23-day round would probably make them quite happy. So I think that's what we're going to do, and I just wanted to explain that kind of in a video format, and I probably will take down some of my older videos that are contradictory in the length of the program. And this also should serve as a consent. Why? Because I just told you what HcG is, why we use it. Now, what could go wrong? One of the contraindications to taking this HcG would be diseases that are made worse in the presence of estrogen, progesterone, and testosterone. So in other words, endocrine tumors such as breast cancer, ovarian cancer, prostate cancer, testicular cancer, those things, those patients should not do the HcG injections. And for you, we have a slightly different type of diet that doesn't involve the HcG aspect. If you had a significant complication with pregnancy, that's not necessarily a contraindication to using this hormone because it's such a low dose of the hormone, but it's something I should know about that we could proceed with caution with. The number one reason people will stop this injection is because it can, in some people, and I have no idea why, and particularly in men, can cause an emotional lability that they don't like. Like it makes them too emotional. And I guess guys don't like that. I don't know. So it doesn't happen often, but I've had 2 people out of a little over 100. So, I mean, that's a real percentage, right? That's a couple percentage of people will feel like they're just too hormonally labile for their taste. And so they choose to stop it. I've had one patient stop it because she thought it made her feel jittery. And, which I guess maybe that's part of the hormonal thing too. I don't know. If there's any questions or weirdness that happens to you along the way, this is the whole purpose of me being involved. We have a weight loss coordinator who's in charge of dispensing your medications to you and being the sort of first person that you ask a question to. But if something weirdo is happening, I gotta know about it so I can give you a medical opinion on should we stop it? Are you okay? What are we gonna do about that? And just kind of work you through the process. The shorter the diet is, the less of those issues we will have. It's another reason to kind of do the shorter diet. It makes it, I think, easier on everybody. Okay, what's gonna happen? This is what's going to happen. You're going to come in, you're going to meet with our weight loss coordinator who will give you some information, some background. If you choose that this is what you want to do, you will be given informational booklets, a website to go look at, books to read, a paper to read. That's all posted on our website to educate yourself. You'll wind up meeting me either by phone or telemed or in person. I like meeting people in person, but sometimes I can't coordinate that with your schedule. So we have to talk so I can go over your medical history, risks, benefits of the procedure, what your expectations are, what my expectations are, how you're going to get a hold of me if you have an issue. Those are all important things. I'd like to go over your labs from your primary care doctor. Take a look at it, how's your cholesterol doing, what's your blood pressure, what's your blood sugar. That way if you develop any problems, I kind of know what your physiology is doing. Then you will start coming in once a week for 4 weeks. Every week that you come in, you'll get an injection of a lipotropic series of amino acids. Contains methionine, inositol, choline, and carnitine. Those are the things we put in that. And B6 and B12. You'll get that once a week. We will put you on a biometric analysis machine called an InBody. It gives you not just your weight, but your body composition of water weight, fat weight, muscle weight. And that way, we track your progress with that. And then we'll give you an envelope that's filled with tiny little injections that you'll give yourself every day. So we send you home with a week's worth of injections. So that is a 4-week process. So you wind up basically coming in 5 times. Once to meet the coordinator, once to see me and get your first week of injections, and then you're off to the races. okay? So 5 visits to our office, 26 days. There is a maintenance phase to follow, but you can do that on your own. You can always come in and weigh yourself anytime you want to. Part of the package that we add to that is where I'm sitting right now is an infrared sauna, which helps stimulate your metabolism and your liver clearance to help you promote ketogenic diet status, ketosis, fat loss. Okay, so that's why we do that. And all right, so that's the plan. Okay, if you have any questions, you let us know. Our website is SkandiiMedSpa.com. Our email is admin@SkandiiMedSpa.com. Or you can call no, that's my office number. 682-341-9039. Yeah, that's it. You can also have your doctor fax stuff to me at 682-341-9029 fax number. All right, hope to see you soon.